The heart is a muscular pump at the center of the circulatory system. It keeps blood moving to the lungs to collect oxygen and then sends oxygen-rich blood to the rest of the body. Its electrical system controls the rate and rhythm of each heartbeat, and if the heart becomes weak or its rhythm is disturbed, organs across the body can suffer. So in this video, I want to go deeper. First, I'll explain what the heart actually does. Second, I'll go through common heart diseases and disorders. Third, I'll explain what natural support for the heart really means, including specific foods that fit the evidence best. And finally, I'll show why heart disease has become one of the defining health problems of the 21st century, especially in lower resource countries and types of heart treatments. Section 1. What the heart actually does. The heart has 4 chambers. The 2 upper chambers are the atria, and the 2 lower chambers are the ventricles. Blood returns from the body and lungs into the atria, then moves into the ventricles, which pump it back out to the lungs and the rest of the body. Valves keep blood flowing in the right direction, and the heart's conduction system generates the electrical signals that make the chambers contract in an organized rhythm. That means the heart is not just a symbol of emotion, it is a precision organ that combines mechanical pumping, electrical timing, and vascular coordination. If the muscle is damaged, the pump weakens. If the blood vessels feeding it become blocked, the muscle can die. If the electrical system misfires, the rhythm can become too fast, too slow, or dangerously irregular. Section 2. Why the heart matters so much. A healthy heart supplies the body with the amount of blood it needs to work properly. When that flow is reduced, the effects can show up as chest pain, shortness of breath, dizziness, swelling, fatigue, collapse, or sudden death. Heart disease is not just one condition. It is a broad group of disorders that includes coronary artery disease, heart failure, arrhythmias, valve disease, and other cardiovascular problems. This is why heart health affects almost everything else. If the heart cannot pump properly, the lungs can fill with fluid, the kidneys may receive less blood, exercise tolerance falls, and the whole body begins to slow down. Even when symptoms look mild at first, heart disease can progress silently for years before becoming obvious. Section 3. Common heart diseases and disorders. The most common type of heart disease is coronary artery disease, also called coronary heart disease. This happens when the arteries supplying the heart muscle become narrowed or blocked, usually because of plaque buildup. That can reduce blood flow to the heart and cause angina or a heart attack. CDC identifies high blood pressure, high cholesterol, smoking, diabetes, obesity, physical inactivity, and unhealthy eating as major risk factors. Another major condition is heart failure. Heart failure does not mean the heart has stopped, it means the heart is not pumping blood as well as it should. NHLBI says heart failure is a serious condition with no cure, but lifestyle changes, medicines, devices, and procedures can help many people live better and longer. Symptoms can include breathlessness, tiredness, and swelling, and they often get worse as the heart grows weaker. Then there are arrhythmias, which are problems with the rate or rhythm of the heartbeat. An arrhythmia can make the heart beat too fast, too slowly, or irregularly. Some people feel palpitations, fluttering, skipped beats, or dizziness, while others notice very little until a more serious event happens. Arrhythmias happen because of problems in the heart's electrical signaling system. Heart disease also includes valve disease, where one or more heart valves become narrowed or leaky, and rheumatic heart disease, which can follow untreated streptococcal infection and remains a bigger problem in poorer settings. WHO notes that rheumatic heart disease still contributes to cardiovascular deaths globally, especially where poverty and limited access to care persist. Heart disease is not treated with one method. Treatment depends on the problem and how severe it is. Stent, angioplasty, used when coronary arteries are narrowed or blocked. A small tube, stent, is placed inside the artery to keep it open and restore blood flow, often after or during a heart attack. Pacemaker, used when the heart beats too slowly or irregularly. It is a small device placed under the skin that sends electrical signals to control the heart rhythm. Valve repair or replacement, used when heart valves are damaged or not working properly, too narrow or leaking. The valve can be repaired or replaced with a mechanical or biological valve. Bypass surgery, CABG, used when multiple arteries are blocked. A new pathway is created for blood to flow around the blockage. These treatments are used when lifestyle changes and medication are not enough, or when the condition becomes serious or life-threatening. A heart tumor is a rare abnormal growth in the heart. Most are benign, non-cancerous, such as myxomas, but they can still be dangerous because they may block blood flow or affect heart function. Symptoms can include shortness of breath, chest pain, dizziness, or fainting. Treatment usually involves surgical removal, especially if the tumor affects blood flow or causes symptoms. Section 4. Why heart disease defines the 21st century. Heart disease is one of the great health stories of the 21st century because it is both massively common and, to a large extent, shaped by modern living. WHO says cardiovascular diseases are the leading cause of death globally, taking an estimated 17.9 million lives each year, and more than 4 out of 5 of those deaths are due to heart attacks and strokes. About 1/3 happen prematurely in people under 70. It is also a disease of inequality. WHO states that around 80% of cardiovascular deaths occur in low and middle income countries, where people often have less access to early detection, medicines, and equitable care. That makes heart disease not just a medical issue, but also a social and economic one. The burden is also heavy in Europe. WHO Europe says cardiovascular disease kills about 10,000 people every day in the WHO European region and remains the leading cause of death and disability there. So whether we look globally or regionally, heart disease remains one of the biggest killers of modern life. Part of the reason it defines this century is that the main drivers are so widespread. High blood pressure, high cholesterol, smoking, diabetes, obesity, poor diet, physical inactivity, and unhealthy alcohol use. These are deeply connected to modern food environments, urban living, chronic stress, sedentary lifestyles, and unequal access to prevention. Section 5. What natural healing really means for the heart. So what does natural support for the heart actually look like when we remove the hype? First, it means protecting blood vessels and blood pressure. One of the strongest non-drug approaches for heart protection is a heart-healthy eating pattern combined with movement, weight control, and smoking avoidance. NHLBI's DASH eating plan recommends vegetables, fruits, whole grains, low-fat dairy, fish, poultry, beans, nuts, and vegetable oils, while limiting saturated fat and sugary foods and drinks. Second, it means focusing on patterns, not miracle foods. The American Heart Association recommends a wide variety of fruits and vegetables, whole grains, and healthy protein sources, especially legumes, nuts, fish, and seafood, while minimizing added sugars, heavily processed foods, and excess salt. In other words, real heart support looks more like a long-term food pattern than a supplement advertisement. So, if you want specific foods to mention for your audience, the most evidence-aligned examples are fruits, vegetables, whole grains, beans, lentils, nuts, and fish. Olive or other non-tropical vegetable oils also fit heart-healthy patterns better than diets heavy in saturated fat. This is the simple part many people overlook. Heart protection often looks ordinary. Better food, less salt, less smoking, more movement, and better blood pressure control. Third, natural support does not mean trying to treat serious heart disease with food alone. Coronary artery disease, heart failure, dangerous arrhythmias, or valve disease often require medical treatment. Lifestyle changes matter, but they work best with proper diagnosis and treatment, not instead of them. NHLBI is explicit that heart failure, for example, is a serious condition that may require medicines, devices, or procedures in addition to lifestyle support. Section 6. From older traditions to modern evidence. Long before modern cardiology, traditional medical systems linked lifestyle, food, breathing, movement, and emotional balance with heart well-being. The World Health Organization's current traditional medicine strategy supports integrating traditional, complementary, and integrative approaches into health systems in ways that are evidence-based, safe, and regulated. That is the right mindset for heart health too. Respect tradition, but test claims properly. So, the mature message is this: many older traditions were right to emphasize walking, moderation, calmer living, and food quality. Modern medicine adds something essential: blood pressure measurement, cholesterol testing, ECGs, scans, emergency care, stents, surgery, and proven medicines. The smartest approach is not ancient versus modern. It is using supportive lifestyle habits while also respecting medical evidence. So let's bring it together. The heart is a 4-chambered pump with an electrical system that keeps blood moving through the lungs and the rest of the body. When it is damaged, the effects can show up as coronary artery disease, heart attacks, heart failure, arrhythmias, and valve problems. These are not small issues. They are among the biggest causes of death and disability in modern life. And in the 21st century, heart disease has become one of the defining global health challenges because it sits at the crossroads of aging, modern lifestyles, inequality, and preventable risk. It kills millions each year, with especially heavy impacts in low and middle-income countries and a huge ongoing burden in Europe as well. That is the real lesson of natural healing for the heart. Support the body wisely, but do not confuse support with cure. Eat better, move more, control blood pressure, protect the blood vessels, and take symptoms seriously. Chest pain, unexplained breathlessness, fainting, worsening swelling, or sustained palpitations are not things to wait out. The heart is too important for guesswork.